Hello, today we're talking about sexually transmitted infections. So our topic is sexually transmitted infections, and it's an explicit and sensitive topic. And during this presentation, there'll be references to sexual behaviour. My name is Mel Gadd, and I'm a sex educator with Cwmni Addysg Crew Sex Education Company. I thought they were called STDs. Well, the term STD, sexually transmitted disease, and STI, sexually transmitted infection, are terms used interchangeably about the viruses and infections we can catch from sexual contact. We use the term STI these days as it more accurately describes the conditions and how we catch it. We can't spontaneously catch an STI, they are passed from one person to another during sexual and intimate contact. I don't like to think about STIs. People like me don't catch them. Well, STIs don't care about who you are and how you feel about them. STIs are a common infection, and if you have sex, you're at risk of catching one. Many STIs don't have visible symptoms, and people usually don't know they have one, so you can't tell by looking at people or asking them about their STI status. It is normal to catch an STI. That is why there are services to test and treat them. What are STIs? STIs are bacterial infections, viruses, or parasites that people can catch from sexual contact. They can be transmitted by oral sex, vaginal sex, and anal sex. And depending on the STI, they can also be transmitted by sharing sex toys, mutual masturbation, or close skin-to-skin contact. STIs can include chlamydia, gonorrhea, HPV, syphilis, hepatitis A, hepatitis B, hepatitis C, genital herpes, genital warts, pubic lice, and scabies. However, you don't need to be a medic. You don't need to be able to diagnose what STI you have. That's what STI testing is for. Many STIs have no obvious symptoms, and the only way to accurately diagnose an STI is by testing. When symptoms are present, they can include unusual discharge from somebody's vagina, penis, or anus, pain when peeing, bleeding during or after sex, bleeding between periods, sore genitals, a rash, itching, lumps, sores, or ulcers, an unusual smell, a tender or painful tummy. However, these symptoms can exist in lots of other conditions besides STIs. The only way to accurately tell if you have an STI is through testing. You can access free and confidential STI testing via the Test and Post service. So you can pick up a free kit from the Students' Union or order a test kit online to come in the post. This is a free self-test kit for chlamydia, gonorrhea, syphilis, HIV, hepatitis C, and hepatitis B. You provide the samples, post off the kit, and you receive your results by text message. You can also access face-to-face testing at a sexual health service or GP. You make an appointment, meet the friendly service staff, provide the samples, receive results by text message. So the test and post service, if you have a penis, you do a urine test for chlamydia and gonorrhea and a finger prick blood test for syphilis, HIV, hepatitis B and hepatitis C. If you have a vagina, you do a low vaginal swab for chlamydia and gonorrhea, a finger prick blood test for syphilis, HIV, hepatitis B and hepatitis C. There are 3 different kits that you can access: a vaginal kit, a penile kit and a universal kit. These are all available for free from Students' Union, or you can order them from Sexual Health Wales. So let's look at treatment. Most STIs will need treatment. They don't just go away if you ignore them. Most STIs can be easily treated or symptoms managed. You may get prescribed antibiotics, antivirals, retrovirals, or other medicated products depending on the STI diagnosed. Always finish the course of treatment prescribed for you, or it may not work properly. Do not have sex, including oral, vaginal, or anal sex, until you and your partner or partners have finished your treatment. Condoms, both external and internal, and dams are an easy and effective way to prevent most sexually transmitted infections. For more information about condom use, you can watch our condoms video, and you can access free condoms, dams and lube from the Students' Union or via Sexual Health Wales. You can also prevent STIs being passed on by regular STI screening, and you can access free test and post-test kits from the Students' Union or via Sexual Health Wales. If you might be at increased risk of HIV transmission, you can access pre-exposure prophylaxis or PrEP, which reduces your risk of contracting HIV. PrEP is available to Welsh residents for free. PrEP is for people without HIV who are at very high risk of exposure to HIV infection. So if you are HIV negative and don't always use condoms, then PrEP could help reduce your risk of getting HIV. You can access PrEP from your local sexual health services. If you feel you have been exposed to HIV, you can access PEP. Post-exposure prophylaxis is a treatment used to reduce the risk of acquiring HIV infection for people who may have been already exposed to HIV. You must start the treatment as soon as possible after you've been exposed to a possible HIV. PEP makes infection with HIV less likely. However, it's not a cure for HIV and it doesn't work in all cases. PEP is available on the NHS for free, but is only given to people who meet guidelines about its use. The best place to get PEP is a sexual health service or HIV clinic. If you need PEP over the holidays or outside of office hours or over the weekend, then clinics will often be closed, and the best place to go is your hospital emergency department. So what else can you do to look after your sexual health? Well, vaccines are also available for HPV, hepatitis, Mpox and gonorrhea. These are available from your GP or sexual health services. If you're unsure about what vaccines you already received, you can ask your GP for your vaccination record. If you've missed out on your HPV vaccine, you can ask to catch up as an adult. So partner notification and contact tracing. If you test positive for an STI, it's really important that current and previous sexual partners from the last 3 months are advised to get tested too. This is so they can access treatment if they need it, and this helps break the chain of transmission. The Sexual Health Service will do this for you if you wish to remain anonymous. You just need to provide your partner's name and some contact details such as their mobile phone number. If you're having sex, you need to think about some general safety. Who are you with? Who knows where you are? What can you do if you don't feel safe? Communicate your boundaries about what you do and don't want to do, and check that your sexual partner feels safe too. Consent is key when it comes to sexual activity. It's your choice, but also the other person or people's choice too. Be sure that all parties are fully consenting to everything you do together. An absence of a no is not a yes. People cannot legally consent to sex when they're drunk, or if drugs have inhibited choice, if they're asleep, if they're unconscious, if they're forced or they're tricked. External and internal condoms, dams, lube and STI test and post kits are all available for free from the Students' Union. If you want more support around relationships and sexual health, you can access the Student Wellbeing Service. Your local sexual health services are the Betsy Cadwallader University Health Board. Their services are fully confidential, easy access, friendly and non-judgmental, and free of charge. They can provide STI testing and treatment, contraception and HIV services. The Public Health Wales Sexual Health Wales website provides test and post STI screening kits, free condoms to come in the post, and a wealth of sexual health information. This is one of a series of video presentations on relationships and sexual health topics commissioned by Undeb Bangor. They were designed and delivered by Cwmni Addysg Crew Sex Education Company.